Hello, my name is Brook Ward. I'm the President and CEO of the Washington Health System. Thanks for joining us in our third video in our Friday series where we attempt to answer questions about what's going on with healthcare and how it impacts the Washington Health System. With that in mind, my first subject today is the recent executive order signed by Governor Wolf last Wednesday with little notice to healthcare. Essentially, this new law requires all healthcare organizations, suppliers, and manufacturers within 5 days to complete and submit a full inventory of all personal protective equipment, ventilators, respirators, medications, and other things. And then this new law would allow the state to commandeer and take and redistribute that product and supplies where it's most needed across the state. Of course, at the Washington Health System, we want every Pennsylvanian and our peers at every healthcare organization to be safe and have the personal protective equipment they need. You can also understand why we would be concerned to have product taken off our shelves and removed. We need all of that to protect our team members and our patients. So we'll comply with the law, we'll do our part. We hope we won't have product taken from us, but we'll see how that pans out. Locally, though, we are doing our part. For example, just yesterday I was talking with a peer at Excella Health in Westmoreland County and learned that they are desperately low on isolation gowns. We don't have as many as we'd like, but we have enough to share. So literally this morning, Excella is sending a truck over to the Washington Health System to pick up 4,500 isolation gowns to take back to their organization, and we're happy to help. The next question I wanted to address we've been getting is whether or not we have any COVID suspect or COVID positive patients in our hospitals. And like all hospitals in the state, we've been preparing and getting ready for that, and we knew the time would come. And we do have both positive and suspect patients within the Washington Health System Green and the Washington Hospital. Follow-up questions that usually come is how many do we have and who are they? And we have not been given out the specifics on how many we have for a couple reasons. One, it changes daily. We get new patients in, and of course we get patients who recover and get discharged, so it's not a constant number. So to share something that might change in 5 minutes doesn't make sense. Secondarily, as large as Washington and Greene counties are, and our organization being large, it's still a small community. We want to make sure we protect the confidentiality and the privacy of all these patients. So we will not be releasing those numbers. I mentioned we're taking care of positive and COVID suspect. Those are patients waiting for the test results to get back. And we've been doing everything we can to protect both of those types of patients using the exact same precaution to make sure that they are safe, and we keep them in a separate, isolated, precautionary area from the rest of our normal patients. Another question we've been getting a lot is, are emergency departments at both the Washington Health System Green and the Washington Hospital taking care of non-COVID patients? And that's an easy answer. Yes, we're still getting people who are having strokes, heart attacks, broken bones, etc., along with people who are having COVID symptoms. So the only thing different now when you come to our emergency departments is either outside the door or right in the vestibule, they're going to screen the patient to determine whether or not they have COVID symptoms or not. If they don't, they go through the normal ER door. If they do, we take them in a separate door into dedicated COVID areas that are separated from all other patients. That's to keep the COVID patients and non-COVID patients safe and keep our employees safe as well. Many of those patients often get discharged from the ED. They don't go and stay in our hospitals, and that's no different than any other illness. Some folks are really ill and need to stay here at the hospital to be admitted. Others are free to go home and recover in that environment, and so we're dealing with both situations. Next topic I wanted to talk about was just thanking our Washington Health System team members. That's everybody from our volunteers, our employees, our medical staff members. They're all going above and beyond to do an amazing job during this difficult and scary environment to care for all patients, both COVID and non-COVID. I'm grateful to their dedication, their hard work, and professionalism. Many of them are working in jobs that they wouldn't have otherwise done. They've stepped up to help in ways that you can't imagine. They've also done things to connect with patients. For example, some of them have arranged virtual birthday parties for patients who are admitted here and can't see their loved ones. A few of them have donated crosses and prayer cards for family members, patients, and our team members. They've connected with families in ways we would have never imagined in the past. And I'm extremely grateful for all their connections with our patients, but just their hard work as clinicians and employees. They're inspiring, and there's nothing I can do and say to show my appreciation, but I did want to acknowledge it today. It's amazing the work that these folks do to care for our community and our patients. So on behalf of the board, myself, the community, and the patients, thank you very much for what you're doing for our community every day. It's much appreciated. My last topic today is about our Easter weekend coming up. I want and I hope everybody in our communities can stay safe, enjoy, and relax. And I know relaxing in this difficult, stressful time could be difficult, but I hope you can. That being said, please be careful. Continue social distancing. Continue washing your hands often. Remember, if you have to cough or sneeze, do it into your arm, not your hand. And when you leave your house, wear a mask. That will help you protect others from you. And if they're wearing a mask, that will help protect you as well. And lastly, I know it's going to be difficult, and I know you're going to want to, but please don't get together with your extended families for Easter dinner or lunch. This is not the year to do that. I know it would be a break in tradition. I know it'll be difficult. We all have to be disciplined here. We don't want to infect or get the virus from our family members. And so enjoy your Easter with the folks you live with in your home. Stay home. Now, if you have a grandma or uncle or extended family member that you want to provide Easter dinner to, here's my advice. By all means, prepare the dinner or lunch, deliver it to their porch and drop it off, but don't go inside, don't have any contact, and stay 6 feet away from that loved one. And then leave. Let them get the food taken in the house, and you can FaceTime and talk with them later. That's the best and safest way. And what we don't want at the Washington Health System is to have a spike of patients coming in later this week after having been around people on Easter Day. Thank you for your time and attention. Thank you for all your support. We hope this has been informational, and we hope to see you next Friday, April 17th, with our next video. Goodbye.